Hello everyone and welcome to Know Your Drug, powered by MediInsights. The ultimate destination for all things of health and wellness from the fascinating world of medicals and pharmaceuticals. We are here to guide you on Rosuvastatin tablets, exploring the various aspects of Rosuvastatin, their usage, dosage, mechanism of action, side effects, and most importantly, essential advice for taking them safely and responsibly. Before we begin, let me emphasize that the content provided in this channel is purely educational. Always consult a healthcare professional for personalized advice regarding medications. Now, let's get started. Use of Rosuvastatin tablets. Rosuvastatin tablets are primarily prescribed to manage high cholesterol levels and reduce the risk of cardiovascular diseases. They are used to lower low-density lipoprotein cholesterol and triglycerides while increasing high-density lipoprotein cholesterol. Rosuvastatin is beneficial for patients with hyperlipidemia, mixed dyslipidemia, and hypertriglyceridemia. Additionally, it can help prevent heart attacks, strokes, and other cardiovascular complications in individuals at high risk. Next, dosage of Rosuvastatin tablets. The typical starting dose of Rosuvastatin is 5 to 10 mg once daily, taken with or without food. Depending on the patient's cholesterol levels and response to treatment, the dose can be adjusted up to a maximum of 40 mg daily. It's crucial to follow the prescribing doctor's recommendations and have regular lipid level checks to ensure the medication's efficacy and safety. Next, mechanism of action of Rosuvastatin tablets. Rosuvastatin belongs to a class of drugs called statins, which work by inhibiting the enzyme HMG-CoA reductase in the liver. This enzyme is responsible for the synthesis of cholesterol. By blocking this enzyme, Rosuvastatin reduces the production of cholesterol, leading to lower levels of LDL cholesterol and triglycerides in the bloodstream and a slight increase in HDL cholesterol. This helps prevent the buildup of plaque in the arteries, reducing the risk of atherosclerosis and cardiovascular events. Next, side effects of Rosuvastatin tablets. Common side effects of Rosuvastatin include headache, muscle pain, abdominal pain, weakness, and nausea. More serious but less common side effects include liver damage, kidney failure, and rhabdomyolysis, a severe condition involving muscle breakdown. Patients should promptly report unexplained muscle pain, tenderness, or weakness, especially if accompanied by fever or dark urine. Next, important advice for using Rosuvastatin tablets. Patients taking Rosuvastatin should follow a heart-healthy diet, exercise regularly, and avoid smoking to maximize the medication's benefits. It's important to inform the healthcare provider about any other medications or supplements being taken to avoid potential drug interactions. Regular blood tests are necessary to monitor liver function and lipid levels. Pregnant or breastfeeding women should not use Rosuvastatin due to potential risks to the baby. By the end of this video, you'll have a solid understanding of the use, dosage, mechanism of action, side effects, and important advice for using Rosuvastatin tablets. Remember, knowledge is power, and being well informed empowers you to make the best decisions for your health.